Chapter 7, Bone Markings and Bones of Upper Limbs. So there are some different types of markings that you can find on many of the different bones. So it's good to know these generic terms because they're going to show up again and again this chapter. So for instance, we have the trochanter, which is a large rough patch of bone tissue on the femur. We have the tubercles, which are largish, rough patches of bone tissue on the humerus. We have processes, which are usually longish, thinnish portions of bone. We have tuberosities, which are broad, rough patches of bone tissue found on quite a few different bones. We have epicondyles. These are rough bits of bone that stick out toward the distal end of long bones. They are, surprise, surprise, above condyles. And then we have a long, thin, rough patch of bone tissue called crests. And then a spine, which is also a pointy bit of rough bone tissue sticking out. So these are all rough attachment sites for tendons and ligaments. So they're thick and rough to increase the strength of the bone in that location and to make a firm attachment with the tendon or ligament. Then we have smooth structures of bone. These bones, smooth areas, are usually found where moving joints are to reduce friction for the movement at those joints. So we have heads. Heads are big rounded knobs that are nice and smooth. Condyles are smaller rounded knobs, also smooth. Facets are flat surfaces, again smooth. And then for instance with the trochlea, which is a specific condyle found on the humerus. So what is an articulation? An articulation is a joint. So joints can be called articulations. We articulate at articulations. All right, then there's also depressions and grooves. And these depressions and grooves are often there because something's found in that space. So we have alveolus, and alveolus is basically a socket. So the teeth fit into alveoli. Sulcus is a long groove running along the part of the length of the bone, and sulcus is where you might find blood vessels, tendons, ligaments, things like that. And fossas are depressions, so they are like a bowl-shaped kind of, and they allow things to sit in those spaces. And then we have openings and spaces. These are actual pockets where something is located. So we have foramen. A foramen is a hole that goes through the bone. Foramina can be found in a lot of bones, especially bones of the skull, and things like blood vessels, nerves, muscles pass through them. Fissures are more thin, jagged spaces, and we see some fissures in the eye sockets or orbits. And then a meatus is a tube that then comes to a bony end. So it's more like a cave, I guess. And the main meatuses are related to the ears. All right, there are 206 bones in the body in the average human. Or at least 206 that have names. And they get broken up into the axial skeleton, which is the bones along the midline, and the appendicular skeleton, which is the bones for the limbs, and that attach the limbs to the axial skeleton. So the pectoral girdle attaches the upper limbs, pelvic girdle attaches the lower limbs. So in this image, we've got a view of the pectoral girdle. Here's pectoral girdle again. It is composed of two bones, the clavicle, which attaches to the sternum, and the scapula, which attaches or articulates with the humerus. Here is the clavicle, kind of S-shaped, fun little bone. Here's the scapula. Scapula, rather large, sort of triangularish in shape, has a number of special surface markings or features that you need to learn the names of. There's this long ridge on the back of the scapula called the spine. At the end of that is a large, wide piece of bone tissue called the acromion process. Here's the acromion process with a view more immediately into the bone. Then there's this other thick piece of bone tissue called the coracoid process. Here is the coracoid process, And then we have this socket here that's called the glenoid cavity. And so the head of the humerus will fit into the glenoid cavity to give us the shoulder joint. Here is the humerus, anterior side and posterior side. That smooth rounded knob, the head of the humerus. This large rough patch sticking out laterally is the greater tubercle. The smaller rough patch sticking out anteriorly is the lesser tubercle. Then going down the shaft, there is this small rough patch of bone tissue called the deltoid tuberosity. Surprise, surprise, the deltoid muscle attaches there. And down at the distal ends, we have the lateral epicondyle and the medial epicondyle. And it's worth noting the head always faces medially to fit into the glenoid cavity. So if you know which side the head is on, that's where the medial epicondyle is. And here's the posterior view. We see again down at the distal end, here's the anterior view. This knob here, the lateral knob, is called the capitulum. This double knob here, smooth and rounded, is called the trochlea. So trochlea and capitulum. And then a little proximal to the trochlea is this depression here called the coronoid fossa. Then we flip the bone around to the posterior view. This extremely large depression here is called the olecranon fossa. So a lot of structures at the distal end of the humerus. The humerus will form the elbow joint with the radius and ulna. So next up, radius and ulna that are distal to the humerus. The radius and ulna are lie next to each other in our forearm. The ulna is the more medial bone. Ulna medial, radius lateral. The ulna, toward its proximal end, has this smooth C-shaped surface. So it's like the inside of a C, nice and curved, called the trochlear notch. Trochlear notch fits around the trochlea of the humerus. It has a lip of bone tissue sticking out anteriorly called the coronoid process. Coronoid process fits into the coronoid fossa. And then in the back, posterior side, is a big rough chunk of bone tissue called the olecranon process. And the olecranon process is actually the point of your elbow. That point there is the olecranon process. And when your arm is fully extended out, that fits into the olecranon fossa. Then down at the distal end is this pointy bit of bone tissue called the styloid process. With the radius on the proximal end, we have the head, which in this case is shaped kind of more like a disc, smooth structure. It articulates with the capitulum of the humerus. And at the distal end is another little pointy bit of bone tissue called the styloid process. So the radius and the ulna both have styloid processes at their distal ends. Then we have the carpals. Carpals are short bones that make up the wrist. And there are 8 carpals. Then distal to that are the metacarpals. There are 5 metacarpals, and they basically make up the palm of the hand. And then for the fingers, we have the 14 phalanges. 14 phalanges. And the phalanges have special names, proximal, middle, and distal. So there are 3 phalanges in the pinky, proximal, distal, middle, 3 in the ring finger, 3 in the middle finger, 3 in the index finger, but only 2 in the thumb. Only 2 phalanges in the thumb, the proximal phalanx and the distal phalanx. Now, when you number these bones, they're numbered 1, 2, 3, 4, 5. So this is metacarpal 1. And the 1 starts on the same side as the thumb. The thumb side is metacarpal 1, 2, 3, 4, 5. So this would be proximal phalanx 1, distal phalanx 1, proximal phalanx 2, middle phalanx 2, distal phalanx 2, and so on. All right, and that is it for this part of the lecture.